I'm Shernan Holtan, Assistant Professor of Medicine at the University of Minnesota. I work in the Adult Blood and Marrow Transplant Program. I moved to Minnesota from Oregon 5 years ago. And when I moved back here, I was kind of at rock bottom health-wise. Exhausted, working 100 hours a week. That's not an exaggeration. Very stressed. Really had dealt with my stress through food and just was not in a good place in terms of my health. And so when we moved here, I was just really ready to make a big change. I joined this gym with the intention of maybe working on the elliptical a half an hour every other day or something like that. But as a part of joining, there was an opportunity to work with some trainers and participate in some nutrition classes. And I thought, you know what? Yes, Shernan, you're a physician. You should know everything that you need to know to be able to take care of your health, but what you're doing isn't working, so maybe actually meet with some professionals and try something new. So I met with Jason, and we had our first session about nutrition together, just a one-on-one kind of here's what I've been doing and where should we go kind of session. And I remember him saying, you know, I know that you have had a lot of medical training, but how about you just do what I say for a month?
Well, I mean, we basically start, everything's been low fat for the last 15 years, so getting back to eating some more whole foods as opposed to the processed low fat crackers and things like that. And we switched her from doing a little bit of the 30 minutes of elliptical to doing maybe 60 minutes of strength training, and that's where I've seen the biggest results when we're able to kind of change people's body compositions and increase their metabolism, and then that helps fuel their nutrition changes as well. So
I'll be honest, I was totally skeptical. He says, okay, change your diet completely, stop the processed carbohydrates. Of course, I was eating a lot of pasta. I was nearly vegetarian, which is kind of funny now, considering. Mm-hmm. And learn how to do strength training. And again, I was skeptical. I didn't think it would work because of what we were taught. We were taught aerobic training, whole grains, the American Heart stuff that we hear.
6 to 12 servings a day.
Yeah, I thought that's what I needed to do. But it turned out that what Jason already knew, it was really totally life-changing. And I all of a sudden was not so fatigued. I had the energy to get through my day. I started to put on muscle. I started to feel better about myself. I felt less anxious, like I could do more. And without a lot of suffering, to be honest, suddenly I was down 40 pounds. And the next thing I knew after that, I'm in a powerlifting competition.
Yeah, so, a year or two later, right?
A year or two later, but so many things changed about my life and my health after meeting Jason. And this is kind of crazy, right? Because I'm a physician. I should know this stuff. But
it's sort of assumed and implied, right?
But I really didn't. So taking that experience that I had personally, I would see patients in my clinic, and the most common set of complaints that I hear is I'm fatigued, I have no energy, my body hurts, I also can't sleep, and they're looking to me for answers. And honestly, the tools that we have are medications that are really not the right answer for a lot of these complaints. I really realized, you know what, they need Jason. They don't need me. My patients need Jason. I started to tell my own story to my patients, and of course what I went through is nothing compared to what my transplant patients go through. But I saw that there was an answer to some of the really devastating complications that they were going through that didn't have to involve medications. There were some answers that they could actually achieve in a community setting.
Going into the study, we had to design something that was safe. So making sure that we're actually being productive with exercise, and that's something that is kind of lost in translation in the industry because it's, you see on TV Biggest Loser and Boot Camp and things like that. So it wasn't about grinding these people down, it's about building them up. Mm-hmm. So that is something that, with that in mind, designing the study to be every muscle group, safe, effective, but progressive. So, we started a lot of people out using 10 to 20 pounds on a machine, and we got people up to 260 pounds on these same machines. So it's not about, breaking them or trying to do anything crazy. So I knew that going in. I was actually relieved that the people that we had in the study were actually in much better physical and maybe even mental condition than I had initially expected. So that was great. So there wasn't too many concessions that I had to make, and it was about being smart from the ground up. So it worked really well, just getting right into it.
Just like I have to be careful with the dose of any medication that I prescribe, Jason is absolutely masterful at prescribing the right dose of exercise that's just enough stress to make progress without being destructive or damaging or painful. There's no question that going through the transplant causes accelerated aging. And along with that, we have a 9-fold increased risk of dying of cardiovascular disease. So we've taken someone in their 30s, for example, and accelerated their aging, unfortunately, through the transplant procedures, the chemotherapy, and all the inflammation that they deal with, and seen cardiovascular disease, coronary artery disease, or heart attacks in someone in their 40s. So that accelerated aging, inflammation, and cardiovascular disease is a link that is a cycle that we need to break somehow. And we need to think outside of the medical realm, honestly, to help our patients improve those odds. Yes, we can prescribe medications, but there is no medication that is as good as exercise. The day that I can prescribe in a pill what Jason does for all of us, I'll be the richest woman on the planet. There is just nothing better than exercise and engaging your muscles and having your muscles recover and repair themselves and teach your body how to reduce that inflammation. Nothing better than that. And so my hope is that they can pick up this habit and reduce their long-term cardiovascular risk. They met criteria to come into the study. They all had to meet a scale of being what we call frail or pre-frail. They met that criteria. Each of them had some kind of health complication during the study as well.
Yeah. No one had it easy.
No one had it easy. There were, infection complications, graft versus host disease, stuff that happens to our patients commonly. So this was not a crew that was having smooth sailing. This was not the healthiest of the healthy. So I want our patients to understand that this group really gained some resilience. They were able to come in. No one missed a session, really.
Yeah.
I mean, if they couldn't attend one, they made it up in another way.
Yeah.
How many sessions did our patients do?
So my goal was that at the end of 12 weeks that they would have got about 20 sessions, meaning 1 a week with me and about 1 a week on their own. Mm-hmm. And I had actually created a new spreadsheet because some of them got over the 30s. And that was, it's crazy because I try and do that with completely healthy people who are paying me out of their own pocket. And I don't get near that sort of buy-in from them. So to see that from people who have a legitimate excuse to not be in the gym was inspiring.
So they were all in.
Yeah.
They were going through health complications. They were battling their health issues during this.
Yeah.
So my patients would often tell me if I suggested exercise, for example, I don't know how to start, or I'll start when I'm feeling better, or I'll start when X complication is resolved. Honestly, that's true for those of us who are blessed with good health, too. We say, okay,
Yeah.
January 1st, or I'll wait till a certain event has happened, and then I'll really focus on my health. You know what? You can start.
Yeah.
Just any time. These patients jumped into this study in the middle of their own complications and still had them throughout, but they gained resiliency, and they understood, you know what? I can do this. There is never a perfect time. You just got to jump in and roll with it, and having a good coach to help you along the way really makes all the difference.
But I mean, getting your life back, because before any of this diagnosis, before people started feeling poorly, everything we just mentioned could have been done easily. And so to go from 0, but to be back to 60 miles an hour is just, it's so great.
So I have 2 words also, maybe one from the patient perspective, and that might be hope. Now they see that they can take control of their own destiny, within certain parameters, right? There's still going to be medical issues, perhaps there might be some unforeseen complications, but now they know that they are resilient and they know how to overcome what they can on their own. For me, I would just say fun. This was a blast. It was so awesome to watch my patients transform before my eyes. I knew what it was like myself. And so, getting to see all of them during the process and watching that transformation before my eyes, it was just a blast. It was just fun.
change colors there.